Recognizing the member from Vernon-Lumby.
Thank you, Honorable Speaker. I rise to speak to Bill M232, the Long-Term Care Access and Transparency Act. I want to begin by thanking the member for bringing this bill forward. This issue of long-term care access and transparency matters to all of us in this House. Seniors built this province, they raised families, built businesses, strengthened our communities, and they deserve to age with dignity, security, and respect. We all agree on that. Since forming the government, we have made senior care priority, and the reason I want to speak a little bit to it before diving deeper into the bill, because I had the honor to represent this, to work on this file during my last term. We have been investing in assisted living, long-term care, home support, and we have made historic and largest investments in this sector. In fact, BC was the first province in Canada to sign bilateral agreement with the federal government to invest millions of dollars into strengthening home and community care. We acted quickly because we understood that helping seniors remain at home safety is not just compassionate, it's a smart policy, and it helps the wait times in healthcare facilities. And this investment, many seniors are benefiting from that. Because here is the truth, while long-term care is essential for many seniors, most seniors want to age in place. And I have held hands of many seniors crying, like Ivy and many others, that they want to stay in their homes for as long as they want because they built their home. This is their everything. And I know how shattered myself and other healthcare professionals feel all the time when you have to be in that situation and you cannot sign the file or the placement request until the senior is ready. I have worked in healthcare, as many of you know, in this beautiful province for more than 20 years, and I have seen firsthand, as I mentioned, it's not one size fits. And I see that my own mother, along with many other seniors, refuse to go to long-term when we have these discussions, and I can't, it's a tough decision, and I understand that there is need to continue. There is time that when seniors and families do have to make that tough choice. That is why approach has been not one-dimensional. Besides building hundreds of long-term care beds, I want to share that we have built. The reason we need to, there's lots of discussion on both sides, and especially members from across, saying that government or the members sitting here somehow don't care. When we talk about seniors, they are our parents, they are our grandparents. There is no rhyme or reason for anybody, no matter which side of the house you sit on, not to care. That is why our government invested $3 billion into long-term care infrastructure, resulting in building hundreds of new beds created or underway in this province, while we continue to invest in other services, hospital at home program, provide respite care for families, which is essential, as well as a better at home care, which we deliver with United Way. And we are building long-term care beds. There was conversation about interior health, which I am still their employee. We have built more than 500 beds so far since coming into government. And that includes 96 beds in Vernon at Creekside Landing, which also those beds provide proper tub baths, a proper place where seniors can live with dignity, and dementia care strategy was also incorporated in those. But beds are not enough. We must staff them, and that is why our government trained close to 8,000 care aides under HCAP program. That is why we increased the direct care hours immediately right after 2017, 3.15 hours per resident per day, an average too, that is being used now 3.59 hours, because time spent with direct senior care matters. And we're continuing to working towards national 4-hour standard. And yes, we will continue. Some may note that when we say we continue to work, this is exactly why we are here for. That is why people elected us, not to stop, but continuing to work. And now I want to speak another reality we must face. We're seeing cost estimates for some new long-term care construction project coming forward at over $1.8 million per bed. Let that sink in, $1.8 million bed. That is taxpayers' money, that is public money, and when costs rise to that level, we have responsibility to pause and reassess to be fiscally responsible. Because with 1.8 million, we could fund substantial home care supports, caregiver programs, dementia supports, and affordable senior housing or other community-based services to fill the existing gaps. It is not about stopping the progress, it's about making sure every dollar stretches as far as possible to support as many seniors as possible. When we came into government, let's talk about it. We have inherited broken system, and over former government, which many may not like me sharing this reality, over their 10-year strategy, they invested approximately $1.7 million with M in 10 years. And if you break that number down, that is creating 2, maybe 3 beds per year in the entire province. And that is why where we are, it matters why. When I looked at it, when I had that file, I knew that why these gaps exist. Our responsibility has been to fill those massive gaps, but also we dealt with pandemic and then other issues that province faced. Now that Bill M232 focuses on additional reporting requirement and transparency measures. Transparency matters, data matters, accountability matters, but I must raise a concern that I have heard directly from frontline workers. Our nurses, care aides, and administrators already spend significant numbers of hours on documentation and reporting. Healthcare workers consistently tell us that they want more time with the residents, not more time filing more documents. Every additional legislative reporting requirement risks adding to their existing workload, administrative workload. Every extra hour spent on paperwork is hour taken away from direct patient care. We must ensure in our pursuit of transparency, we do not unintentionally increase bureaucracy at the expense of bedside care. It is also important to recognize that as much of data referenced in this bill already collected and publicly reported, the Ministry of Health and health authorities closely monitor wait times. The Office of Seniors Advocate, very important role they have, publishes annual reports with province-wide facility-level data on key indicators. We should carefully assess whether new monthly reporting requirements would meaningfully improve transparency, whether they would duplicate existing framework. And during my previous term, I had the honor to working extensively on long-term care file. We advanced, strengthened our dementia care strategy. We constructed with families. And welcome, Mr. Speaker. Do I still have 2 minutes, or do you want me to turn to quickly? Okay. Yes, so I spoke directly with residents. We listened to families. We heard from experts. We met with care providers, and we heard consistently was that they want timely access, they want quality staffing, they want compassion, they want support at home for as long as possible, and they want government to be responsible within public dollars. That is what we're striving to do. We have invested more than $3 billion, as I mentioned, in long-term care infrastructure, creating hundreds of new beds. We've trained thousands of care aides. We increased direct hours, and we are the first province to sign the bilateral agreement. And we've expanded better at-home care and innovative supports like long-term care at home and hospital at home. And we will continue, because seniors deserve nothing less. As we consider Bill M232, let us do a thoughtfully and carefully, let us think about, let us protect transparency, let us protect frontline care times, let us protect taxpayers' dollars, and above all, let us protect dignity, safety, independence of seniors in our province. This is not about politics, it's about people, it's about our parents, it's about our grandparents. It is about building a system that respects their wishes, whether that means care in the facility or sports at home they love, and it is about supporting the backbone of the system, the healthcare providers, and that is the work we will continue to do because we cannot pause. Thank you so much, Honorable Speaker.